Mitragyna speciosa, which you probably know under its more famous name Kratom, is a tropical tree from the coffee family. It is native to certain parts of Southeast Asia, such as Thailand, Indonesia, Malaysia, Cambodia, or Papua New Guinea. The tree looks like this. There are several strains available on the market. Each of the strains has different effects on the user, and if you take a better look at the kratom leaf, you can actually see the color of the veins. And generally, you can either buy red kratom or green, yellow, or white. Kratom has psychotropic properties, and you can expect both stimulant-like effects and opioid-like effects from it. In your brain, kratom interacts with opioid, adrenergic, and serotonin receptors. For opioid receptors, it has the highest affinity to mu receptors and lower affinity for kappa receptors. The effects differ between the strains because you can expect different levels of active alkaloids in various strains. Alkaloids are the molecules that are responsible for the desired effects. In coffee, the active alkaloid is caffeine. In kratom, the main active alkaloid is called mitragynine, even though there are over 40 active compounds in the plant. The levels of active alkaloids actually depends on the conditions the plant grew in as well as on the strand. But generally, red strands are reported to be more sedating to the user, and green, yellow, and white strands are more stimulating. And the effects are also dose dependent. Generally, you can expect stimulation if you take 5 grams of kratom or less. At 5 to 15 grams of kratom, you can expect more opioid-like effects. If you go over 15 grams, the effects are sedating and analgesic. The stimulant-like effects give you an increase in your alertness or your physical energy. Some users might actually experience a stronger need to socialize. Some people describe mild euphoria and increase in empathy or sexual arousal. The opioid-like interaction is responsible for pain relief and euphoria. Some people feel calm. This effect is called anxiolytic. The half-life of mitragynine is estimated at around 3 hours, and according to some studies, it actually might be a bit longer. But how can you actually use kratom? Well, kratom leaves can be chewed, and where I'm from, it's pretty common to get the leaves powdered, and you can actually make tea from the powder or do the infamous toss and wash or fill capsules. While you can't dissolve mitragynine in water, putting the powder in some liquid will actually help you gulp it down better without choking. Some people also mix it with liquidish food like yogurt, and kratom itself is pretty bitter, so some people try really hard to cover the taste with something more palatable. It's also possible to add something acidic to the mix to make the extraction a bit easier. Toxicity of kratom is dose dependent, but generally if you exceed 8 grams, you can expect more negative side effects, and I will go through these negative side effects in the risks section of the video. But be careful about your dose, especially if you're not used to taking kratom or it's your first time. Remember that you can always take more, but taking less can be a bit complicated. Since you are most probably ingesting the drug, remember that the onset of effects can take a bit longer. First effects can generally be felt after 10 to 20 minutes after ingestion, but full effects come in later at about 30 to 60 minutes after ingestion. And you can expect to feel the effects for about 5 to 7 hours, with a peak between 2 to 4 hours. Smoking kratom is relatively rare, and I've never heard about anyone injecting it. But who actually uses kratom? Well, kratom has been traditionally used in Southeast Asia for centuries. People in Thailand and Malaysia self-medicate substance abuse of other opiates, and some also chew the leaves to get benefits for their long work days in the heat. I found sources saying that there's no stigma if a man is using kratom to support his family, but women would actually face stigma for using kratom. In Thailand, people also drink something that's called kratom cocktail, or 4 times 100. And that's basically a wild cocktail of boiled kratom leaves, coke, antithesis syrup, coffee served over ice. It's a wild ride. But in recent years, we've also seen kratom's popularity grow in the Western world. In the USA, there are about 5 million users based on the membership numbers from the American Kratom Association, and it is often used as a legal high, and based on its legal status, many assume it's actually safe. Other great motivation to take Kratom is to reduce exhaustion and improve mood. People on Kratom report a greater sense of well-being, and someone actually described it as, I felt very relaxed in my body but felt the need to be active in my mind. And people also experience sensory enhancement. In certain cases, people also use Kratom to substitute for other drugs, often it's alcohol or opiates. And in this case, you would see why they would classify Kratom more in like the harm reduction category rather than the harm itself. And it's true that in some cases, substituting a drug with Kratom can have significant improvements on the quality of the person's life. And of course, if you're considering this, the official guideline is to find a professional to help you through your problems, but I understand that not everyone is in the position to do so. Some people also use it to self-medicate their mental health issues such as anxiety or depression. But along its benefits, Kratom also comes with several side effects, and commonly these are agitation, tachycardia, drowsiness or dizziness, and confusion. Oh, and don't forget the lovely itching that often follows like opioid use, and Kratom can also make your stomach upset. That's a very common side effect, and you can actually vomit. Some people experience numbness in their mouth or throat. And in more serious side effects, you have seizures, hallucinations, and rarely even a coma. But it's important to mention that these more serious side effects are pretty rare. Of course, just as with any other substance that changes your perception, you want to avoid driving on Kratom. And just as with other psychotropic substances, using Kratom has potential for developing a substance use disorder or dependence. Chronic use of Kratom leads to tolerance or even cross-tolerance with other opiates, and you risk cravings and withdrawals if you do not get your dose. But I will talk about withdrawals more in the withdrawals section of this video. You can find the timestamp here or in the video description. Kratom can cause insomnia, decrease your appetite, and therefore cause weight loss, but just wait before you get into your swimsuit because you can actually experience temporary erectile dysfunction and hair loss. Plus, you can get pretty constipated. Some studies state that the toxicity and development of addiction is more because of 7-OH mitragynine, which is a different alkaloid found in the plant, while mitragynine itself has lower risk. But you're drinking the whole plant, so does it really matter? Kratom is processed in the liver, so it can hurt your liver, and it can also interact with different processes that are happening in your liver. That means that it can interact with other things that enter your liver, such as any medication that you might be taking, and in fact, drug-drug interaction between Kratom and medication is a huge concern for doctors as Kratom use becomes more common. The drug-drug interaction can mean a lot of things. Your drugs might not work, or you can actually create a completely new, more dangerous chemical in your liver that will be toxic to your health. And some of these combinations are fatal, and if you are in a situation where you're 100% set on using Kratom, please try to do at least a little bit of research before combining it with other drugs, illicit or medication. Definitely be wary if you're using any antipsychotics, and let me know if you'd like to see a video about various drug-drug interactions that you can commonly encounter when using Kratom. Other organs that are affected by Kratom, and therefore you can actually hurt them by drinking Kratom, are kidneys, thyroid, and heart. And especially if you have like a kidney disease, stay away from Kratom, it's really unsafe. As with any other unregulated drugs, one of the biggest concerns is actually quality control, because no one is checking the quality or purity of your Kratom powder you buy. And in this sense, you have no guarantee other than a trust me bro. The amount of active molecules can vary between the batches, so there's a bit of a risk of overdosing. It was also reported that some Kratom powders were modified to contain more of the active molecules that's not natural in the plant, or even be contaminated with dangerous chemicals. There are actually cases when people died because the powder they bought contained toxic substances or dangerous chemicals, and Kratom was also responsible for a salmonella outbreak in 2018. It's ill-advised to use kratom during pregnancy, as the developing fetus can become addicted, and this can lead to neonatal abstinence syndrome when its source of kratom is gone, and your baby might actually encounter kratom in milk if you consume kratom and breastfeed, so also stay away from kratom if you're breastfeeding. In 2016 and 2017, CDC linked about 150 deaths to kratom. Although this was mostly a result of drug interactions, it seems that kratom's effects can be blocked if you pre-administer an opioid antagonist, but it will not work if you've already ingested kratom. As you can get physically dependent on kratom, it's possible that you will experience some withdrawals when you decide to stop using it, and some of these symptoms are similar to withdrawal symptoms of other opioids, so you can experience the fun package of nausea, vomiting, chills, diarrhea, pain, and irritability. Your appetite might go down significantly, and so can your sex drive. Many experience insomnia. And these are just the physical symptoms. In psychological symptoms, you can generally expect dysphoria, anger, or even outright hostility, tension, restlessness, and sadness. And other psychotic symptoms, such as hallucinations, are rare. One study found that about 43% of users reported some withdrawal symptoms. Now, what about kratom and drug tests? Well, ever heard about these people who claim they lost something because they were positive for kratom? Well, there's some chance that those people might have been lying. Kratom, its active compounds, or its metabolites are not detected by a typical drug screening test. And of course, you can get tested for kratom. It's just that it's a more specialized test than what is usually done. But for how long do you have to worry about getting a positive result for kratom? As always, these numbers depend on how often you take kratom and what your usual dose looks like, but for saliva tests, you can expect to be positive within 2 days of consumption, and the same goes for blood tests. In urine tests, expect about a week. For hair tests, yes. In theory, the molecules can be identified from a strand of hair, but the amount of kratom that stays in your hair is so low that it's actually not useful for many tests. And although there were several attempts to make kratom illegal, it is still mostly legal in the US. Several states criminalized its possession, that's Alabama, Arkansas, Indiana, Wisconsin, Rhode Island, and Vermont. In 2016, the DEA wanted to put it in Schedule 1, but the backlash was so intense that they didn't. In Europe, it's mostly legal with the exception of Poland, Ireland, Romania, and some Nordic and Baltic states, and you can refer to this map from European Kratom Alliance website. Now here's the kicker. All those things I said about kratom being used in Southeast Asia, well, people are using it, but that doesn't mean it's legal. Kratom will become illegal in Indonesia this year, and it's already prohibited in Malaysia. On the other hand, Thailand fully legalized it in 2021. And due to kratom's legal status, it's completely possible to buy it in stores or order it online. And in one way, this is incredibly problematic because a lot of stores don't have age checks, and using kratom should be limited by age. Plus, at least in Europe, I've seen many vending machines selling kratom to whoever throws money in, so it's easily accessible to even the youngest of children. And while I don't think that kratom should be banned, I am sure that this is a problem that needs to be solved, and in the Czech Republic, for example, the government is preparing a new law that would allow psychotropic substances such as HHC or kratom in adult-only shops, but that's something that would happen in the future. But when we talk about kratom, it's important to mention that kratom is mostly not responsible for aggressive or antisocial behavior, and there are clear benefits and side effects are mostly mild. And even though serious side effects are rare, take them into consideration and think about drug-drug interactions with meds or other illicit drugs. Sometimes it's not the drug itself, but the combination that makes it lethal. One problem that I had with some studies is that they were using self-assessment questionnaires, and with these you will have some kind of selection bias because maybe it's not just middle-aged, middle-income people that use kratom. Maybe it's just people who are more willing to answer your questionnaires, right? But regardless, if you do want to take kratom, make sure it's legal in your country and be careful with the dose. And remember, you can always take more, but you can't get it out of your bloodstream, and don't toss and wash, that's a horrible way to die. But that's it for today's video. I think deep diving into Kratom's pharmacology might be a bit too much for this introduction video, but I am considering making a specialized video about Kratom's biochemistry and physiology, so let me know if that's something you'd find interesting, and thanks for watching, have a great one.